Hey everyone, what's up? This is Dr. Charlie, physical therapist, and in this video I want to share with you a few simple ways that you can start to move the nerves in your leg and or in your back if you have some type of back, butt, or sciatica problem. Now, why might this be useful? Because if you're watching other YouTube videos and or if you're trying sort of the traditional approach to dealing with nerve pain, then you're probably trying nerve glides and or the stretches, foam rolling, things like that, and it might not be working. In fact, just the other day I had a woman reach out to me and she said, "Hey Dr. Charlie, I'm trying these nerve glides and it just keeps pissing off my nervous system. It keeps making things really angry." So in this video I want to show you some safe yet simple and effective ways to get things moving in the right direction that won't flare things up. And for those of you who don't know me, again, my name is Dr. Charlie Johnson. Welcome to my channel. I'm a physical therapist and I help people all around the world with back, butt, and sciatica problems. Most of these people have tried lots of different things and not gotten relief. So I teach people how to use movement as medicine so that they can learn to fix themselves and not rely on others to fix them. So also I've created a DIY diagnostic guide. If you're not sure as to the cause of your back, butt, or sciatica problem, be sure to download that and grab your free copy above and or somewhere in the description. All right, so the first option I want to show you is a way that we can treat the mid-back or thoracic spine to reduce the sensitivity of the nervous system and improve the tightness and or pain that you might feel in your back, butt, or leg. So one thing you should know just anatomically, big picture without getting too detailed, is the middle part of your back. The thoracic spine is basically a place where a lot of nervous system activity happens. So it's sort of a hotbed for the nervous system. You have a lot of activity going on there. And so what we have seen and what the research suggests, although of course you have some research that says it does this, it doesn't do that, right? So you have some competing sort of findings there, but research does suggest that moving the middle part of your back, for example, if you get the mid part of your back cracked or something like that, can actually reduce sympathetic nervous system activity. And the sympathetic nervous system is involved in the fight or flight state. So if we can calm that thing down, because remember, getting out of pain, and or if you're not sure of this, getting out of pain is not only getting out of pain is not only just thinking about the structural side of things of what's going on, but your body and your brain are also involved in pain processing. So that we know if we can calm down the overall sort of heightened state, the fight or flight state of the nervous system, then we can also experience pain relief and get you feeling better. So we want to treat the middle of the back because it's away from the painful area. It's upstairs, if you will, and it's often a safer way to begin movement. So there's kind of two ways you can do this. I'll show you one primary way, and if this doesn't work seated in a chair, you can absolutely do this in a different way, and I'll even show you how to utilize that foam roller that you've been rubbing on your butt and or your leg in a way that is probably more valuable and effective. All right, so first things first, before doing any of these tests to prove whether or not they're valuable or not, I always recommend doing a pre-test, and then after doing each of these things, you can do a post-test. What's the point of this? It helps you answer whether or not this thing is actually something that is useful for you. All right, so let's just say that Heather here has pain in the back on the left side, maybe pain in her left butt or even pain in her left leg. All right. What she would want to do is she'd want to find a motion that is yucky or doesn't feel very safe. And a common motion that people have trouble with if they truly have some type of butt or sciatica irritation is they will have trouble doing a leg raise. So just sitting there, what you would do is you would straighten the painful leg very slowly, and you'd probably notice that, yucky. All right? And so just get a sense for how far that leg can go and what it feels like. All right? And then the right leg, just make sure that's okay. No problem. So we found the left leg is yucky, the right leg's okay. So we've got something we know we can try to fix. All right. So first motion we're going to test to try to see if we can move the mid-back, kind of wiggle that around and improve the leg raise. And if we improve the leg raise, then we know that somehow, either theoretically because we reduce the activity of the nervous system, we reduce the fight or flight state, and or mechanically we did something there. I don't really care, honestly. If it improved that motion, then we know that we're headed in the right direction. All right, so what you would do is you would sit probably a little bit further up on the chair, and you're literally just going to twist your trunk to the right and to the left. I don't care if you sit up really tall. I don't care if you relax a little bit. You can put your hands on your belly. It doesn't honestly matter, but go ahead and just twist your trunk to the right. How does that feel? Good. Okay, and twist your trunk to the left, so you're going to do it right and left. How does that feel?
That feels good too.
Okay, so they're both good. Okay, so now what you're going to do, if they're both good, is that that means that they're both options. So I don't care. Let me ask you this, Heather. If you had to twist to the right 1,000 times or you had to twist to the left 1,000 times, which would you prefer?
Right.
Okay, so even though they're both good, twisting to the left is good, twisting to the right is good, twisting to the right is a little bit better because notice she said that my preference if I really had to choose would be twist to the right, okay? So the right is just a wee bit yummier than the left. So what you're going to do is just do 2 sets of like 10 or 15 twists to the right. Okay. Go, we'll do that now. All right, great. So first key has to feel safe, right? In which case it did, and actually both sides felt safe, but the right felt safest. And now what she would do to see if it worked is?
Retest.
Retest what?
My left leg raise.
Perfect, okay. Retest yucky motion. So go ahead and retest that. Got it. And you can see in this case, or at least in this example, right, it's a little bit better. Okay, so not only does motion feel safe, but it actually helps her. Okay, so again, we won't test, treat, retest maybe with everything, but first motion or first option as it relates to sort of a maybe outside the box nerve glide, right, would be a trunk twist. And you might think, how is that gliding the nervous system? Again, we talked about how the mid part of your back is a hotbed for the nervous system. There's a lot of activity going on there, so you can indirectly influence the nervous system, reduce the sensitivity of the nervous system just by wiggling some things in the mid back. Okay, so it's safe because it's away from kind of the butt and the leg in many cases, but at the same time, it's also stimulating the nervous system in a way that is perceived to be safe and non-threatening, all right? Now, let's just say that you twisted the trunk to the right and you twisted the trunk to the left, and for whatever reason, both were yucky. Or sitting's terrible and you just can't tolerate it. So here's what I want to show you. Yeah, so there's this thing that all of you probably know about, and it's a foam roller. I'll drop a link below to the ones that I recommend or the one that I recommend. Some of them are super hard. Some of them are super soft. Some of them have knobs on them. Some of them vibrate. Some of them you could probably stick ice cubes in or put in your refrigerator. I don't know. Nobody's invented that. It's maybe not a bad idea. Somebody would buy it. That being said, what you could do is you could use this foam roller for good, not for bad, okay? And so what you would do is this. You would lay it on ground, all right? And then you, the person in pain, the test subject, all right, would position yourself such that your mid-back, kind of right around bra line, is on the foam roller. All right, you good?
Is that right? Yeah.
It's perfect. Yeah, so right around mid-back. Now put your hands behind your neck and kind of interlock them.
Okay.
Perfect, and the reason for that is so that you're supported, all right? Now, what I don't want you to do is I don't want you to pull your head like that, all right? So yeah, the spinal cord connects to the base of the brain, goes all the way down. So if you're in this slump position, and heck, if you're watching this and you have some type of back, butt, or leg pain, you might notice that if you look your head down, it feels a little bit more yucky. That's because it's pulling upwards on the system, and it could irritate things. So just make sure that it's neutral. And then all you're going to do is you're going to give some input. So you tested your leg raise, right? And you're trying to see if that's what that feels like at baseline. And then go ahead and just start arching over the foam roller. And you might hear some snap, crackles, and pops. Perfect, back on up. So we'll call that 1 rep. All right, let's go again. Perfect, and if you want, you can maybe kind of go up 1 inch. Perfect, right there. No lower than that. Again, that's kind of bra line area. Work a couple reps there. Now go up 1 inch again. Sorry. Scoot your butt up on the back. Yep, you got it.
That felt good.
Yeah, that felt good, right? And that's why people pay big money to go to someone who cracks their back. But you can do it on your own. So again, you can use this foam roller as a fulcrum point, get some nice motion or stimulation. Just think of this as an input. Don't think of it as foam rolling per se. Just it's an input, a different input. And it might feel safer for you than just sitting on the chair. It might feel easier for you to just lie down. If you have one of these anyway, it's one of those things that falls out of your closet when you open it because you have so many other balls and different gadgets in there, then just use it, but use it for good. And so, I forgot about you for a second.
Yeah, I'm just keeping going back
All right.
here.
Yeah, so pick a sample size, folks. Pick, 20 reps of maybe arches over the foam roller, or maybe do it for 30 to 60 seconds. There's no exact science there. And then let me ask you this, Heather. What would you do?
Retest my leg raise.
Perfect. You would retest your leg raise. And if retesting your leg raise, number one, if this was safe, right? And then number two, if retesting your leg raise proves or shows that it was a bit better, then that's awesome, right? You can indirectly stimulate the thoracic spine or the mid part of your back to potentially reduce nervous system activity, reduce the fight or flight state, and find some relief. So the second way you could glide the nervous system in a way that's a little bit safer than the traditional approach of just trying to take this painful leg, because here's what most people do. They take this painful leg and they say, hey, just keep doing that, right? Just keep going until you feel the pain, and it's like, ouch, 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 right? And so yucky in, yucky out, all right? So what you could do though is you could do that once, you could see where it's at, and then go ahead, pull the toes up on this side, you'll be able to see them as they come into the camera, and work this leg until you feel tension in the back of the good leg. You're doing this on the good leg. Maybe you do 2 sets of 20 reps. And what we've seen in the research when we've looked at kind of how the nervous system is pulled on and or the tension that's created in the nervous system when we move the body is that by creating tension in the good leg, we actually see it slackens the nerves on the bad leg. It kind of gives a little bit of a pulley effect. If the pulley were in the base of the spine, it creates a little bit of a pulley effect, a shimmy effect, something like that. Okay, I think you get the idea. So by moving the good leg and putting some tension through the nervous system on the good side, you can actually influence the other side. And again, the goal is to find a safe point into moving the nervous system and potentially reduce the overall sensitivity of that leg in an indirect fashion, all right? And then again, you could retest to see same, better, worse on the painful side. That tells you, was it valuable or was it not? All right, an alternate to that seated leg raise. Maybe seated leg raise is just terrible because sitting is terrible. A lot of pressure on the buttock and things like that. Very common for people with back, butt, and sciatica problems to not be able to sit very well. So maybe you can't sit, but you're like, hey, I want to do that kind of idea, Charlie. How else could I do it? Well, you could do it lying down. So what you would do is you would take your yummy leg, right? So take your right one, yep, bend it, hold the back of your leg, interlace your hands. Now that's a little high, just there. So kind of maybe not as much of a clasp. You just want it around 90 degrees. Perfect. So just gently hold it so this way your muscles in your belly and whatnot aren't activating while you're doing it. And then go ahead, straighten up until you feel a gentle stretch. You can see she even shakes a little at the top because she gets some stretch there, right? And so she can just work that good leg and she can still get some type of effect and or motion through the bad leg, all right? So this is just an alternate if seated was too yucky. Third and final option here, to glide your nervous system, but in a pretty safe way. So this third one is really super functional, and it's something you do every day to get off the toilet, get out of bed, probably bend down to pick things up, and it's a squat, okay? So a lot of people don't see as a squat as a nerve glide, but it is. You're pulling or tensioning through the buttock, but then kind of slackening things down behind the knee, and then when you stand up, you're just doing the opposite. I thought a bird just hit the window, but it didn't, all right? So here's what you're gonna do, really straightforward. By the way, it's often helpful to have some type of like feedback via chair or something external to you, so this way you have a target, and it's a nice little cue in case you're one of those people who maybe like don't squat often and are trying to figure out the form, right? So go ahead, you're literally just gonna tap your butt on the chair and back on up. Perfect. And that's it. And as you get more advanced, a little bit deeper. So the deeper you go, the more tension she's going to get through her buttock at the bottom. But again, as she bends down, she creates slack. Hold it down there. I like these pants for this. No, they don't work that well. But she creates slack in the back of the knee, right? But then she gets tension in the buttock. As she stands up, she gets tension at the back of the knee. There's more tension on this side, but there's slack in the buttock, right? So it kind of, if you can picture it, tensions one area and it slackens the other. And so you're getting this dynamic motion, if you will, of the nerves through the buttock, through the back, through kind of everything during this motion. And so again, you would test leg raise, you do, as long as it's yummy, 2 sets of 15, 20 sort of squats or butt taps, whatever you want to call it to start. Obviously, if you can't tolerate that, you need to do less, maybe you do 8 or 10, that's totally fine due to your tolerance. And then you would retest, same, better, worse. But a super functional way that's generally safe for most people, that often gets the nervous system moving and can start to reduce symptoms and get you more functional and stronger at the same time. So that's all I got. Hopefully this was helpful. So to summarize, lots of people out there trying to do nerve glides and or nerve tensioners or slump stretches and things like that, or trying to massage their butt cheeks, when in actuality that's just aggravating the problem and reducing blood supply to the nervous system. So what are a few indirect ways that we can actually get the nervous system moving in a way that is safe for most people? Well, we can start away from the area of the problem. So we can start to move the thoracic spine. We can reduce that fight or flight response, the sympathetic nervous system, potentially by moving that area. We can move it via some type of seated trunk twist, or we can lie down and use that foam roller you've been using in a way that is actually helpful and not harmful. The second way would be to perform some type of stretch on the good side or nerve glide on the good side, because we know that actually impacts the bad side in a very gentle way. You can actually get some type of gentle input to the bad side by moving the good side in the form of some type of seated leg raise and or even on your back, right, as the modification. And the third way is some type of just squat. And we all have done this. Helps have a chair behind you, but it's a nice way to kind of get tension in one spot, slack in the other spot, and just keep kind of gliding or massaging the nerve in a very functional way that most of us are familiar with. So that's all I got. Hopefully this was useful. Let me know your thoughts on this. Leave comments below. Also be sure to hit the subscribe button as well as the bell for notifications when we go live every single week. Thanks so much for checking this out. Let me know if you have any questions. Thanks.